Brazil records its deadliest day yet from the coronavirus pandemic. Hello, I'm Anand, and this is The Heat. Brazil had 881 confirmed deaths within 24 hours on Tuesday. By Wednesday, the country's death toll topped 12,600, passing France to rank 6th in the world. Later, we'll focus on what's behind those numbers, but we begin with the latest here in the United States, and for that, we turn to CGTN's White House correspondent, Nathan King. Nathan, great to see you. There was a hearing yesterday on Capitol Hill here in the U.S. Congress. Among those testifying was the country's leading infectious disease expert, Dr. Anthony Fauci. And he wasn't as optimistic as President Trump about the country reopening at this stage of the pandemic.
No, and he stressed that he's giving health advice, not economic advice. But the quote that really sort of stuck in some of the politicians' craw was the fact that he said, look, if you open up too quickly, you could actually trigger an outbreak, another outbreak which will be difficult to contain, and therefore turn the clock back, he used that phrase, on the economic recovery itself. There was also things that he said about reopening schools, that you have to be careful that this dismissive attitude that perhaps children don't suffer or can not get COVID-19 has to be measured, because we have seen related illness as well. So it sort of poured water on the enthusiasm, the cheerleading, if you like, for opening up the U.S. economy. And actually, we just heard from U.S. President Trump, who was in the White House with the governors of Colorado and North Dakota, and he actually just said that he disagrees with Anthony Fauci and accused him of trying to play it both ways. We know they've differed on many things, but to have it out in the open like this suggests that, the coronavirus task force is as disunited as ever.
Public differences there between the president and Dr. Fauci. Nathan, there are more states that are reopening this week. Are they meeting those criteria that were set down by the White House task force?
Yes and no. And by the way, I just wanted to point out that there's a poll done by the way, that sees a lot of people agreeing with Dr. Anthony Fauci. 74% of Americans would rather slow down and go back to work with safety measures in place without a spike in cases, and only 24% want it reopened. But you're absolutely right on the states now opening up. There are these criteria, and remember what they are. There are declining cases over the number of weeks, decline in hospitalizations over a number of weeks, enough hospital beds and protective equipment for staff as well. Now, some states are meeting them. Maryland, for example, the next door state here in Washington, D.C., is actually doing quite well. In fact, they're moving to limit reopenings. But it goes from county to county. For example, in Texas, you have big cities like Dallas and Austin resisting the push to opening up, because they haven't seen the criteria that was set by this White House materialize, because they're large urban centers, whereas parts of rural Texas have. So you have arguments between governors and mayors. You're seeing in Wisconsin, by the way, the Supreme Court of that state just overruling the governor on opening up. So it's a bit of a mess. And as you know, COVID-19 doesn't really respect borders of counties, let alone states or even nations. So it is a mismatch. But you do have a tendency for Republican and also more rural states that are away from the epicenters of, say, New York, New Jersey, California, to want to get the economy back up, because they haven't seen as many cases. But if you look at the latest data, the numbers may not be comparable to New York in terms of cases of death, but the percentage growth in rural America is climbing, and climbing quite fast. And we're also seeing a lot of data that shows people are starting to dump social distancing measures as they get a little, well, let's just say fed up, fatigue from the lockdown. We all have a bit of that, right?
Yes, we do. Thanks, Nathan.
Yeah.
That's CGTN's Nathan King reporting from the White House. Now, let's get back to the situation in Brazil. The University of Washington predicts that more than 88,000 people will die from the coronavirus in Brazil by August. It's a dire warning for a country already reeling from the pandemic. I spoke earlier with Dr. Luciano Cesar Azevedo. He's a professor of emergency and critical care at the University of Sao Paulo. Dr. Luciano Azevedo, thanks so much for joining us.
It's my pleasure. Thank you very much for the invitation.
The coronavirus is, of course, posing a big threat in Brazil as well. Looking at the latest figures, more than 80,000 infections and more than 12,500 people have died from COVID-19. But I'm wondering, could those figures be distorted or skewed because of a lack of testing? Could it be a lot worse?
Yes, actually, we estimate that the numbers are higher than this because we have few laboratories that are certified by the government. So there is and even for these labs, there is a long line of tests that are already collected from the patients and that are waiting to be processed and to have the results ready. So what we see, the numbers you just gave from today in Brazil are the results of tests that were collected 10 to 14 days ago. So what we see here is probably a underestimation or a subnotification on the number of cases that is very significant for our country.
Brazil is, of course, a huge country. It's a vast country stretching from the Atlantic all the way deep into the Amazon. Where are the worst concentrations of infections?
Actually, the pandemic started in Brazil in some capitals of Brazilian states, mostly related to hubs of international flights, connection from international flights, like, for instance, Manaus in the Amazon, also Fortaleza in the northeast of the country, Sao Paulo and Rio de Janeiro in the southeast of Brazil. So we started with the richest people that came from traveling to Europe or to the US, and when they returned to Brazil, they were contaminated, and this is where the disease started in our country. And we have some capitals and some states that were not very much affected by the pandemic so far.
President Bolsonaro has played down the severity of the virus. In fact, he referred to it as a little flu. He's had deep differences with the professionals in his government as well. In fact, the previous health minister was fired. The country now has a new health minister. But I'm wondering, to what extent was this crisis aggravated or exacerbated by President Bolsonaro, who refused to recognize the seriousness of the pandemic on the one hand. On the other hand, he also wanted to see the country reopen sooner rather than later.
So this is very difficult for the Brazilian people to understand. As you have a president that comments on the importance of the economy to continue moving and says that this was just the pandemic is just a little flu. On the other hand, the healthcare, the health ministry, and also all in the states, the governors and the state authorities for the health, saying that you should stay at home, you should stay isolated, and we should be in quarantine. So this is very difficult for the population to understand these disparities in the speeches of these authorities, and the result of it is that the compliance with the social isolation in Brazil is very low, and according to this, the number of cases are increasing, and this is a major threat to the Brazilian situation, to the healthcare system in Brazil. And also, we understand that Brazil has a huge inequality, economic and social inequality. We have a lot of people that lives in the what we call here the favelas, which are communities for the poor people, where they can live, for instance, in houses with 1 or 2 rooms, and up to 10 people can live in these houses. And therefore, these people, it's very difficult to do social isolation. And also, most of these people do not have formal employment, and they have to leave home to sell things on the streets or to work in the construction. And so it's really very difficult for Brazil to do social isolation, and that's a reason for what we think that probably the pandemic will hit very hard in our country.
That's right. Brazil has a very large informal economy. Has there been any kind of lockdown imposed by the government?
So what happens in Brazil is that our Supreme Court stated that states and cities can do local lockdowns or local quarantines according to the scenario in their cities or in their states. So some cities already started to do lockdowns, but even for lockdowns, they are not completely accomplished, or the people does not have a total compliance even for lockdown. So the police and the healthcare authorities are having a hard time to keep people away from the streets.
How prepared is the country in terms of medical infrastructure, hospital beds, even intensive care units, protective equipment, as well as test kits?
So Brazil has a healthcare scenario that needs to be clarified. We have here a private healthcare setting that takes care of 25% of Brazilian population, and we also have a public healthcare scenario, healthcare setting, healthcare institutions that take care of 75% of the Brazilian inhabitants. When the pandemic just started in the private scenario, the private hospitals increased their capacity, started to deny or to postpone elective procedures, and increased the number of ICU beds to cope, to adapt their occupancy to the new disease, to the pandemic. But now what we see is that the number of patients in the private scenarios is decreasing, because the pandemic is starting to move towards the poorer parts of Brazil, to the favelas and to the poor communities. And then we are seeing that the public healthcare system is starting to collapse in some places, in some cities, the cities that already started to lock down. And in other cities, we have 90 to 95% of, for instance, ICU beds occupancy in the public scenario. So we are trying to adapt. We are increasing the number of ICU beds in the public hospitals, even with partnerships with the private institutions or the private companies. And we also constructing provisory hospitals, like the ones for army at the wars. There are major being built at soccer stadiums, for instance, to have more beds for the population in the public healthcare scenario.
Dr. Luciano Azevedo, thanks so much for joining us.
Thank you very much for your invitation. It was a pleasure for me.
There's more to talk about. Let's get to our panel. Joining us from Rio de Janeiro is Miguel Lago. He heads the Institute for Health Policy Studies. Thiago de Aragao is the Director of Strategy for Arko Advice, a consulting firm right here in Washington, D.C. And also with us from Rio de Janeiro is journalist Ionova. Thanks to all of you for being with us. Anna, let me start with you. As we just heard there from Dr. Azevedo, the situation in Brazil could be a lot worse. The country is still awaiting a load of tests, and in many instances, tests have not been carried out. But President Bolsonaro is already considering reopening parts of the economy. He was talking about reopening some businesses like beauty salons and gyms. What is your assessment of how serious the situation is there?
So I think we've seen some mixed messaging from the beginning on the crisis from the federal government, maintaining throughout that the coronavirus, in terms of the virus itself, was less dangerous than the potential economic impact. So President Bolsonaro has continued to push for reopening, and what we're seeing now is that messaging really trickling down to a deterioration of the quarantine and social isolation measures that many governors and mayors attempted to put in place. So lots of people in Rio and throughout Brazil are not respecting those social distancing measures, and we're seeing that really take a toll. Now, as we're seeing the numbers skyrocket and the death toll really become more and more devastating each day, we're now at a point where lockdowns are probably likely and necessary, but at the moment it's difficult to go from a situation where there's a deterioration in quarantine to imposing full lockdowns.
Miguel, Lago, let me get your thoughts on a lockdown. Should the government be enforcing a stricter lockdown to avoid even a bigger catastrophe in the country?
Hello, good night. It's a pleasure to be here with you. Yes, for sure. This is, if we look at our neighbors, for instance, Argentina, Chile, Colombia, countries that have more fragile health systems than we do, they are dealing better with the pandemic than we are. So if we look at Argentina, that did a national lockdown at the beginning of this crisis in March, they have now 350 deaths, more or less, and Brazil has more than 12,000. So certainly. However, it's not easy to do a lockdown in Brazil, even if the government wants to do a lockdown in Brazil, because of the social inequalities we have, urban inequalities, but also socioeconomic inequalities.
Thiago de Aragao, it seems that this issue, this crisis in Brazil has become politicized like it has in the United States, like it has in many, many other countries where we have medical professionals saying, look, you have to impose these lockdowns, you have to practice social distancing, you have to impose tighter guidelines on the one hand, and politicians saying, well, we have to reopen the economy, otherwise we'd have a bigger problem. And President Bolsonaro wants to reopen the economy, but that could have disastrous consequences for the country, couldn't it?
Well, good night for everyone.
Essentially
Yes, naturally, it could have disastrous consequences for the country, because at the end of the day, the population is getting further and further confused. There is a false equivalence in the narrative that we hear from medical experts and from politicians. And this false equivalence creates a sense of choice to some sort of individuals who believe that they actually have a choice to make in a situation that there is basically very little choice given to them. And the crisis became very politicized in Brazil, also because of the structure in Brazil. We are a federative republic. The states in Brazil, they have a lot of autonomy. They are the major decision makers in terms of issuing a quarantine or a lockdown in comparison to what the federal government can do. But at the same time, President Bolsonaro is probably one of the biggest opinion makers in Brazil. So when you have governors having to take a decision that is not pleasant under the economy outlook, especially in a country with so much inequality, as it was well said by Miguel, this leads to a situation in which the individual, he is highly influenced by the major opinion maker, the president, versus a decision that comes from the governor, which is naturally very unpleasant.
Anna, you wanted to say something? Go ahead.
Yeah, no, I was just going to point out that the messaging coming from the top has really had an impact here, and we're seeing the deterioration of the lockdowns really showing that. And part of this is because the messaging of go back to work, reopen the economy really resonates with a lot of people who are surviving on their daily earnings, whether that's cleaning homes or driving cars or selling fruit on the streets. So for them, that's a really compelling message. And the fact that it was coming from the president was hugely impactful.
And one other point, Thiago just told us that Brazil is a federal system. Is there a great deal of tension between the central government, the president, Bolsonaro, and governors around the country?
There has been tension from the beginning. I think most governors and most mayors were pretty quick to take measures and shut non-essential businesses, schools, recommend to residents to stay at home. But at the moment, I think what's interesting is that they are not necessarily being as strongly worded and strongly voiced about kind of further restrictions to movement, including lockdowns. We've seen some very limited lockdowns in the north, which, as was previously mentioned, has been devastated by outbreaks, including the Amazon state of Amazonia, with Manaus having its health system completely overburdened by the virus. And what we're seeing is some very small pockets of lockdowns, but we're not seeing those in major centers, including Sao Paulo and Rio. And I think that goes back to the fact that these are not popular measures, and there's pressure to reopen the economy at a time when doing so could be particularly dangerous.
Miguel, Lago, which parts of the country are hardest hit by this virus? And what about medical infrastructure in different parts of the country? How are they coping?
So basically, what we have in Brazil is that, and it's one amazing thing, and it's an exception in Latin America, is that we have a national health system that is very strong and very solid. So we have, in a continental country, Brazil is the only country in the world with more than 100 million inhabitants to offer free health services to all its citizens. Which is absolutely a very, very difficult task to do. And Brazil is a very unequal country, and it's not only unequal between classes, but also unequal between regions. So what we have is that we see some cities with ICU beds and respirators, and hospital facilities, and other regions in Brazil where there's a total lack. So we have a recent study, that shows that 10% of the population of Brazil lives in areas where you don't have one single ICU bed or respirator. So the distribution of medical equipment is very, very unequal, despite the existence of a unified and national health system.
And Miguel, are there any efforts being made right now to fix that, to get these kinds of ventilators, respirators into places where they would be needed?
Absolutely. Brazil has three great challenges, and they should be coordinated. So first of all, you need to expand health infrastructure in the public sector, especially on the regions where you don't have enough ICU beds and respirators, etc. Then you have a second challenge, that are the human resources. We don't have enough health professionals in many regions of the country. And what we're seeing now is that those health professions that we already have, they are falling ill very easily because we're not protecting them. So Brazil, we have already more health professionals that died in Brazil than in the United States, for instance, or in Spain or Italy, countries with much more cases and much more deaths than we had. Second challenge is to tackle the human resources and make sure that we have our health professionals and their safety and they're operational. And third one is to flatten the curve. And we're not doing enough measures in this sense. Some local governments are doing, others not. The federal government is not coordinating the system. So it's a major problem. If you don't do the three at the same time, we will have a total collapse of the hospital system.
Thiago, President Bolsonaro is using an argument that's been used here in the United States by President Trump, and that argument is that the pandemic could do more damage to the economy than the disease itself. How are Brazilians responding to that argument?
Well, this is a very typical narrative when we look at ourselves in a binary world, in a polarized world. The coronavirus never brought us an option. It's not a choice between health or economy. The economy will be destroyed with coronavirus, as the health system will also suffer immensely with the coronavirus. It's a given. But when you put an offer or an alternative or two opposite poles in front of each other, and you act in defense of one of those poles solely, you basically create an illusion that by opting to one of the two can actually be saved, or at least be restored. And this is a fallacy. This is a mistake that at the end of the day, after the coronavirus, whether the treatment and the decisions from the government were successful or not, it will leave a trail of death, and it will leave a trail of severe GDP fall and downfall. So this is a problematic, because when the president brings this narrative to the table, that the problems in the economy could generate more harm than the coronavirus, this is something that has no basis, because Brazil has never experienced something like this before, and it creates the illusion that he is able to protect the environment, the economic environment. So this is very complicated to cope, and it's very hard to be delivered at the end of the story, after a few months have passed.
Anna, what kind of impact has this pandemic had on small businesses in the country? You know, Dr. Azevedo told us about the informal economy and the impact it's having there, but what about other more formal, smaller businesses? And is there any kind of help forthcoming from the government?
So the situation here with, in terms of the emergency aid that was approved by the government, it is a small amount that really hasn't been able to give much relief to people, especially that are working in the informal sector, which is millions of people in Brazil, which is why it's so difficult to impose quarantine in this country, where 40% of people work in some sort of informal employment. What I've seen in the needy, more kind of peripheral needy communities like the favelas is that there's a lot of people that are out of work. There's a lot of people struggling. There's many people that are surviving on basic food baskets. The shuttering of small businesses has been absolutely detrimental to many of them, and their survival is in question. So there is real economic pain being felt by people, especially on the lower end of the income bracket. And it's being felt now. It's not something that will start kind of coming through later on.
Miguel, Lago, very quickly, we've just got a bit of time left. What do you know about conditions in some of the more remote parts of the country in states like Amazon, Amapa, among indigenous communities?
It's a great question, but I just wanted to add first to what Anna said about the basic income that was approved by the Congress. Again, Brazil has an amazing way to reach the poorest part of its population. We have a database that is absolutely incredible that reaches almost 80 million people. There are those more in need. So the government, if it was a competent government, it will be absolutely, could perfectly give the basic income that was created by the Congress to 80 million people immediately.
Right.
But the government is not competent. That's one of the major issues. So the federal government is now not only telling fallacies, as Thiago very well outlined, but also is an incompetent government in terms of doing that. And yes, the COVID is expanding in the Amazon region, where is exactly the region where we have less ICU beds and less hospital infrastructure. So it's very worrying what's happening in there.
Yeah, we have to go. We've run out of time. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand in Washington, D.C. Thanks for watching.